Thank you all for attending. Good to see you all. Many faces I know, some I don't. So it might be an idea just before we've got a few apologies today as well. We'll go through that in a moment. But shall we just? There are some new faces here. Shall we just whip round the room so that we've got an idea of who we are and where we're from? Paul, let's go that way.
Get the scene to work. Good morning, everyone. I am Councillor Paul Brading. I am the chair of the Children's Services Education and Skills Service Committee.
Hi, I'm Karen Lucioni. I'm the chair of the Environment and Community Protection Committee. I have to read it right because I was putting it.
Thanks, Karen.
Hi, everyone. I'm Jo Jeffries. I'm Associate Director of Public Health, so I'm deputising for Simon Bryant today.
Morning, everybody. I'm Colin Rowland from the Isle of Wight Council. I'm Strategic Director of Community Services.
Thanks, Colin.
Good morning, everybody. Andy MacDonald, Isle of Wight District Commander for the Police.
Morning, Ian Boyd here today for IWALC, Isle of Wight Association Local Councils. Thank you.
Welcome here. It's been a long time coming.
Yeah. Good morning. I'm Jo Dare, CEO of Isle of Wight Youth Trust and representing the voluntary sector here today.
Yeah.
Good morning, I'm Donna Claydon. I'm the Senior Partnerships Manager for the Integrated Care Board representing the Isle of Wight.
And hi everyone, I'm Scott, the Place Partnerships Director working for the Integrated Care Board.
Thanks.
Good morning, I'm Steve Curtis. I work for Portsmouth City Council, but today I'm here on behalf of the Solent Grove Partnership.
Good morning, everyone. Lee Matthews, Strategic Manager for Community and Culture, Isle of Wight Council.
Thanks, Lee.
Hi, Simon Scribb, Public Health Practitioner Analyst.
Yes, Simon.
And Ian Lloyd, Strategic Manager for Partnership and Support Services, Adult Social Care.
And Megan is here to assist.
Megan Tuckwell, Democratic Services Officer.
Thanks, Megan. So we have online, I can see four. We've got two different screens here. Are they? Would you just like to explain who you are, please, on screen? Whoever.
Yeah.
Yeah.
Good morning, James Roach, Director of Primary Care and Local Care at NHS Hampshire and Isle of Wight.
Thanks, James.
Hi, morning everyone. I'm Hinal Patel and I'm Community Pharmacy Clinical Integration Lead at NHS Hampshire Isle of Wight.
Morning everyone, I'm Thomas Ruxton. I am a Public Health Analyst at Hampshire County Council.
Good morning everybody, my name is Catherine Walsh. I'm also a Public Health Analyst from Hampshire County Council.
Yeah. Hi, I'm Marie-Claire Lobo, Consultant Public Health Medicine for Hampshire County Council and the Isle of Wight Council, and I'm here to support Simon on the pharmaceutical needs assessment.
Okay, thank you for that. Look, thank you all for explaining. Well, Bill Jordan, I'm the leader of the Isle of Wight Council, and thereby under our constitution, chair of the Health and Wellbeing Board. It accompanies the role of leader. It's not an elected position. Apologies and substitutes. I know we've got some apologies, Megan.
So apologies have been received from Simon Bryant, Councillor Claire Morsdale, Wendy Pereira, Jill Kennett from iWalk, and Health Watch, and Michelle Legg, Vice Chair.
Michelle's my doctor. I always miss her when she's not here. It's the only chance I get to see her. She's lost. There you go.
Ashley Whittaker has also apologised, I believe, hasn't he?
Thanks, Paul. Okay. Then we have some substitutes, but that's been done. Okay. Minutes of the last meeting. They're there for those of us that were here. Any comments, any actions out those minutes? There are no actions. I need a proposer for those minutes for those that were here. we got anyone here that was even here? I might not have been here, actually. No, I was. I'm going to need a proposer from someone. Nobody here. Thank you. Can I have a seconder for that? Thank you, Karen. So we need to, those that were here, please show to accept those minutes. Yeah, I'll better do that as well. Okay. Thank you. Again, declarations of interest. Do you have any declarations of interest? No declarations of interest. Public question time. I'm told there are no public questions, Megan. There are no public questions. Nobody in the gallery. No media even. No, that's, you know, the press are not here to yeah, an important committee for the island, our community, and the press not here to report on it. But there we are. I'll make my feelings known to the editors, I think. Members' question time. There are no members, thank you. Chair's update. There are no updates from me, so we'll move on. Yeah, we're doing well. That leads us on to item 7 now, pharmaceutical needs assessment 2025-28, pages 9 to 96 in our papers. So we need to receive and consider report, Jo.
Thank you, Chair. So I'm just going to give a very brief overview and introduction, and then my colleague Simon will take you through the slide set. So just a brief overview of the process, which is undertaken by the County Council on behalf of the Health and Wellbeing Board, and it's been undertaken largely by the Public Health Intelligence team with input from a steering group. You'll hear a bit more about that. It is a statutory duty of the Health and Wellbeing Board and has a 3-year lifetime. So this this pharmaceutical needs assessment will replace the current one, which ran from 2022 to 2025. And I'll hand it over to Simon. Is it helpful to put the slides up, or has everyone got the pack?
Okay, so that's on the screen. It's a PDF, hence why you've got the little bits down the side. So the Isle of Wight Pharmaceutical Needs Assessment 2025, sorry, I was connecting, so I may be repeating what you said, Jo. It replaces the one from 2022, something that we have to do on behalf of the Health and Wellbeing Board. So it gives an introduction to it, and then the scope of the P&A is then that it shows pharmaceutical services, the population health, the findings and the conclusion, and the engagement, and what we do to write the P&A. So the P&A is a statement of pharmaceutical needs of the population in relation to community pharmacy and distance selling pharmacy, and dispensing practice services, assessing whether pharmaceutical service provision meets the current and future needs of the Isle of Wight's population within the lifetime of the P&A. So statutory duty sets out the minimum information that must be contained, and the process is followed, and it's a market entry document which informs applicants within the Isle of Wight area for inclusion on the pharmaceutical list, which is determined by such application by NHS England and the ICB. What is not in scope of the P&A is staffing levels, non-statutory services, pharmacy developments, availability of medicine, and the quality of service. So the P&A process, it was undertaken by the Isle of Wight Council Public Health on behalf of the Health and Wellbeing Board. There was a P&A steering group which was established with representation from key stakeholders, which ensure that principles were adhered to and the governance of the document, data collection and analysis, and the sign off and everything else. So it has a 3-year lifetime, so it replaces the 2022 Isle of Wight Council P&A. So the pharmaceutical services in the Isle of Wight, for the purpose of this, it's the essential services, which is defined as necessary services for the purpose of the PNA, advanced services, enhanced services, and local pharmaceutical services, which is contracts that are the equivalent of, but are commissioned locally. So we've looked at the population and the health of the island. So we took into account the information that's in the Isle of Wight Joint Strategic Needs Assessment and other resources, and the projected population change between 2023 and 2030. We've used a gap analysis to determine whether the number, the geographical distribution, opening hours, and choice of pharmaceutical services on the island meet the current and the future needs. Okay, we then went to consultation, which is in line with statutory requirements, which was 60 days from the 20th of January to the 21st of March. We asked for views of the public and other stakeholders. We received a total of 6 responses, all of which were positive. Most represented the views of organisations. There were no responses from members of the public. There were some amendments made in line with comments, where appropriate and within the scope. And essentially there was a change in the contents of the PNA to ensure that it actually accurately reflected the pharmaceutical services needs. So the key findings of the PNA was that we have a good geographical spread of community pharmacies providing necessary services. The majority of the Isle of Wight residents live within a 5-mile drive of a pharmacy. Those outside of the 5-mile drive zone are in sparsely populated areas, and in those areas there's a dispensing GP in the South Wight area. To cover that, the community pharmacy density is 19 per 100,000 population, which is slightly lower than the average, the national average of 20.8, but it needs to be taken into account the size and the staffing levels and the rurality of the island. All 27 pharmacies we have on the island operate on a standard 40 core hour opening hour contracts per week, with some of them having additional supplementary hour provision. However, there are no pharmacies currently permanently contracted to open past 6:30 p.m. on weekdays following the closure of the 100-hour pharmacy in Newport in June 23. So that, we suggest, creates a potential gap in out-of-hours pharmaceutical services for people. And although 4 pharmacies across the island have a prescription collection point, which allows access to repeat prescriptions 24 hours a day, 7 days a week from a lockbox in the front window of the pharmacy, obviously for prescriptions issued by urgent treatment or anything like that, there's no way of getting that out of hours. All 27 pharmacies provide a full range of face-to-face essential services, and there's a good provision of advanced services and a variety of locally commissioned and enhanced services. And of the 8 community pharmacies that responded to the contractor questionnaire, 6 of them provide collection of prescriptions from practices, 4 a delivery service to patients free of charge, and 3 with a charge. So the conclusion of the PNA is that whilst the number, distribution and choice of pharmaceutical services meets the current and future needs of the Isle of Wight, the closure of the 100-hour pharmacy in Newport in June 2023 creates a potential gap in a pharmacy offering out-of-hours services on the island, which could be met by a new pharmacy or by an existing provider increasing their opening hours. So the recommendation is that the Health and Wellbeing Board agree to this, ratify it, and approve the final PNA for publication.
Thank you, Simon.
Thanks, Simon. Any comments, any questions, Karen?
I don't know if anybody here can
Yeah,
answer.
Chair. Hi.
Oh, sorry, I'm just asking a
Apologies, I
question.
can't put my hand up.
I just wondered that with the lack of out of hours, what's the impact on 111? Because you can actually get out of hours medication from them. So it just seems ridiculous. We're not doing something because it's obviously going to impact on that side.
James.
Yeah, so there is a 111 provision and there's a connection there. So we are looking at our sort of urgent care and out of our pathways to things like pharmacy, optometry and dentistry. So there is an established process. But I think, and Hanal, please come in, I think we are keen to look at where we can extend a 100-hour provision. I mean, a key part of our access plan in primary care is to extend the access available through pharmacy. And where that has worked well, we've seen this made a real difference in terms of reducing pressure on our GPs and helping patients with long-term conditions to manage their health more independently. Hinal, do you want to pick up the 111 element and then I'll come back to ambition?
Of course. So in the interim, as an ICB, we have provided an extended opening of a pharmacy on the island between 5:30 and 8:30 Monday to Friday, and obviously we are monitoring in light of obviously changes that are happening within pharmacy, but also for the PNA to be released on the island. On another hand, we're also working with the meds team in terms of the stock that has been kept for out of hours, and we do have a comprehensive list in terms of items that are prescribed and dispensed within those. The GP extended hours that obviously run on the island also hold some stock. So things like antibiotics, steroids that are needed are dispensed within those. And hence, we do support the recommendation of the PNA in terms of opening up the gap that it is kind of highlighted, and to have like a longer term solution by either an existing pharmacy or a new pharmacy opening. But we regularly monitor in terms of the provisions and what is kind of kept in stock to ensure that out of hours run smoothly and medications are available for the patients.
Okay, thanks for that. Oh, yeah, I can't see that screen. Paul.
Thank you, Leader. Thanks for the report. It's really good to see that there is a strategy in place for the next 3 years. What comes across as very positive, I don't think it is very positive at all. The consultation, 6 people responded to a consultation. That is pathetic. Yeah, so you can't say it's a positive consultation when only 6 people responded. So how did the consultation happen and why have we only got 6 responses? You then went on to say 8 of 27 pharmacies responded. That also is pathetic. So how can you get a fair picture when only 8 of the 27 pharmacies bothered to respond? And that comes on to the, there's a good positive thing. Everyone's within 5 mile drive of the nearest pharmacy. We're an elderly population, many of which don't drive. So I don't see 5 miles to the nearest pharmacy as a positive at all, really. And again, none at weekends is a real risk because elderly people, my father, for example, keeps hiding his medication. He gets it delivered and then he puts it in the drawer somewhere, forgets where he's put it. So, I had a situation where a weekend he needed medication and I couldn't get it. A regional pharmacy in Shanklin are brilliant and he got delivered to him on the Monday, but on a Saturday he couldn't find his medication and I couldn't do anything about it whatsoever despite trying. So I don't think it is really a positive situation. It stems back, I think, to the consultation. So my question really is, why was the consultation with residents and pharmacies so poorly? Because that needs to be addressed urgently to get a fair picture of what's actually happening on the islands.
I think, Chair, that's one back for Simon in the first instance, and then happy to come in after.
Shall I come in, Chair?
Sure.
I can't answer why the consultation was not as well responded to as you have pointed out. There was a low response. The way in which the consultation was done was very similar to the time that we have done this 3 years ago, when we did get a slightly higher response, particularly from residents. It is something that we've looked at, since the data has come in. It's difficult to understand what the difference in the, I guess, interest of the population was 3 years ago compared to now. So I I feel that that is something that we have, tried to address by following the procedures that we've followed on for previous consultations. So there's nothing to indicate prior to the work that the consultation would have been poorly responded to. I take your point that it's potentially the wording around it was a positive consultation might have been misleading. But I think what we have seen is that those who have responded have indicated in a positive manner. The fact that only 8 out of the total number of pharmacies responded, again, is a similar picture. We've pushed the consultation out in a number of different ways. And it's very difficult to force people to respond if they don't feel it's something that they want to do, or they've got time to do, or that will make a difference, etc., etc. So maybe that's something that we need to think about. I don't know if James or Hanal.
Yeah, I mean, I'll come back on that if that's okay. So I think you're right in terms of to what extent the pharmacies consult within this formal framework. It is mixed, and it is looked upon differently. And you're right to suggest we can't compel people to respond. We can only encourage them. I think moving forward, where do we think things are going to change? I think nationally there's a different sort of model and mindset now around community pharmacy. So the model is changing. There's a big focus on things like pharmacy first, independent prescribing, and more clinical services being provided in community pharmacy. From a primary care perspective, we're really keen to look at opportunities in which community pharmacies can integrate with GPs, work in partnership, provide services. There's also opportunities for our community pharmacists to work with other providers on the island as well. So I think one of the things we're really keen on now, we've got a clearer mandate in terms of the 10-year plan, is try and engage our pharmacists around not just what they do currently, but how we could work with them to deliver a more effective and integrated model in the future. So we had a similar conversation at Hampshire Council in terms of the P&A. And one of the things we have committed to is to come back to their ask, and very happy to come back to this board and start to give you a view on our strategy, how we're responding to this, what this means in terms of service provision. And in the same way we have for dentistry, try and lay out a very clear plan for the Isle of Wight in terms of these ambitions nationally and how we deliver locally. We absolutely recognise the potential of community pharmacy. They do need support, and I think that's there nationally. I think the other risk that the board should be aware of is that the sector is quite financially challenged. Often these are independent businesses. They're not part of multiples. They are sort of exposed, if you like, to financial reality. So we are looking at what we can do, not just to support the clinical model, but what else can we do to support the operational and business model to help them sustain their service provision and become an even greater part of the NHS moving forward. So, Chair, we'd be very happy to come back to this board in a few meetings' time to give you an overview of our strategy, how we're responding to this and what it means for the island.
Thank you, James. We would like that as an update. I'll go to Paul and then to Ian after. Thanks, James.
My supplementary question is, forgetting the pharmacy piece, I'm more concerned with the members of the community. I didn't know there was a consultation on pharmacies going on, and I look at all the consultations, and I do most of them. I wasn't aware of a consultation. If I was making a decision or preparing a paper based on a consultation that I'd done as part of my committee with 6 responses, I'd do it again. I wouldn't produce a paper based on 6 responses. I would just do the consultation again, do it better, different. So as a board, are we allowed to, is it within our remit to say, do the consultation again before we sign off this paper? Because that would be my proposal, because I don't think a paper on 6 consultations is acceptable.
I can see some frowns around the room, Paul, but look, this is a health and wellbeing board concerned with the health and wellbeing of our island, our community. And if things are not right, it falls to us at a strategic level to understand why those things are not right and to try and implement some improvements. I think that's what we're all sat around the table trying to do. That's not easy in some cases, but nonetheless, we need to try to do that. So I think the short answer is I need to talk to, or we would need to talk to Public Health, who carried out the consultation on behalf of the council, but that if we as a board will be able to register our discontent, if that were the case, on this pharmaceutical needs assessment. Let's talk about it a little further. I've got some questions too. Ian.
Yeah, thanks very much, Chair. Really interesting, but I do agree with Councillor Brading that it kind of feels like a technical assessment of resource on the one hand, with a little bit of consultation kind of nailed on the end, and so that's quite a strange match in some ways. And I think one way of reaching out to community partnership is through the parish network. So I think increasingly the trust in the ICB and the health sector needs to engage with the parishes. 100% coverage. They are forever organisations. They already invest £7.5 million in the island every year, and it only goes up. And so in terms of a geography of care at community level, they're kind of neglected, I think, as an active partner, not just a consultative partner, but an active partner in terms of building, because they're empowered, those with general power of competence certainly are, to build community partnerships that can support, for example, the business model for local pharmacies by supplementary, complementary services. So it's just a point to suggest that the parish network, individually or through IWEL, because IWEL still doesn't have 100% coverage, which is mad, but we'll fix that. They are there, that's their job, to be the community geography to support precisely this kind of endeavour. So it would be great to see them used more. Thank you.
Yeah.
Thanks, Ian. Good points. Joe. Simon and then Joe.
Just to say, the last P&A 3 years ago, we had lots of responses from parish councils and who promoted it to their residents. I can't say how it was communicated to them this time. That would be for the communications team to answer. We sent it to them to do what they normally do. A couple of things that were brought up with regards the contractor questionnaires, that only 6 of the 8 of the 27. That actually went out twice. It went out once across Hampshire, Southampton, Portsmouth and the island. First time around we got 4 responses. Hampshire got very few, Southampton got very few. It went out again, and then obviously we got the extra 4, so we got 8. So it did go out twice to the contractors, but the level of response was very similar across the parish.
Joe.
Thank you. I would just like to not clarify, but reiterate the fact that I respond to a bit of your point actually about you're absolutely correct that it's a technical analytical piece of work. There is quite a specific framework that comes from the centre which tells health and wellbeing boards how they must how the P&A should be carried out and what should be included in the P&A, what's in scope and what's out of scope. That doesn't preclude that we could have had better reach. But I think there is, just to kind of put on that point, that what we're assessing is about the I guess quantity and access to community pharmacy. That the P&A is what is out of scope of the P&A is the quality of those services. So it is a tricky one, and oftentimes, if people are frustrated or they can't access things, I'm not saying we shouldn't hear that, but the P&A is not the place to collect that kind of information. That would be a slightly separate type of consultation. So what we did consult on, but didn't get that many responses around, was those very specific what are the necessary services. And as Simon said, in the guidance for the P&A, it's not absolutely set out what that word even means. But that's why we put together the steering group, which was a wider steering group, so that we could really agree in a technical sense what that means for those like James, who are then going to be tasked with commissioning that pharmaceutical provision, because that document that's the purpose of the document. It's to aid commissioning decisions based on what the minimum can be. There's lots more that can be done, but the pharmaceutical needs assessment is very tight in scope. So just to kind of put a bit of context around it.
Joe.
Can't switch my mic off, sorry.
Thanks, Chair. I had two questions, having read the report. One is that there was a recommendation that the 100-hour pharmacy, which closed in June 23, should be reopened, but it closed in June 23. So I'd be really interested to know what steps have been taken since then, since we're now in July 2025, to encourage that back. And the second one, I think, is a comment really, that I'd be interested to know the impact of distance selling pharmacies, because again, the report talks about 2019 being at 1.4% in terms of how people are using pharmacies, and by 2023 that had gone up to 5.6%. I suspect if you were to take the same information now in 25, it's drifting up. And the trouble is, pharmacies are small businesses, as you said. They are community or organisations as well. And the trouble is, if you don't use them, you will lose them. So what are we doing to try and ensure that pharmacies are accessible? Councillor Brading made the, very personal point there. Otherwise, this drift is going to continue, and then even more problems with access are going to happen for those who are most vulnerable, who can't, go in, certain hours to them.
Thanks, Joe. I had similar questions actually, but so I want to have a go at that. So what's happening about the 100 hours that's been estimated has been lost, and what's been done since it's lost? Where has that been taken up in the system, and what are we doing to replace that if it's required?
Can we'll answer that, Chair, and I will come in on that in a second. Can I just take the second point first, if that's okay?
Sure.
So the second point I think is really important, and it links to what I said earlier. So for us, it's about creating a landscape for community pharmacy where effectively they can earn beyond dispensing and they can be a clearer part of the service model. So that's why things like Pharmacy First are really important, because it creates additional income, it provides footfall, and it provides more relevance within a sort of an NHS model. So one of the reasons I want to bring the strategy back is not just to talk about what we want to do clinically, but also give you some assurance in terms of what we're doing to support the business model of community pharmacy and what that means. So I think that second point is well made. Absolutely agree with it, and be keen to bring that back into this group on a regular basis. A key part of that will obviously be getting more providers to do 100-hour pharmacies, doing more providers to provide clinical services. I'll ask Kunal just to touch on the specifics of the 100-hour pharmacy bit. But again, Chair, I think it comes back to the need for a strategy for the island for community pharmacy and making sure that we're all aligned on that.
Yeah, so I think in terms of the 100-hour pharmacy, since the closure, there has been a national amendment in terms of regulation. So the 100-hour pharmacy is going down to 72 hours rather than the 100-hour contract we knew 18 months ago. And clearly, once the Sainsbury's or the Tesco's contract was closed on the island, there was no new contractor that kind of came forward. In the interim, also the PNA, I think just after COVID was kind of running low, and it was meant to be refreshed, which is this year, kind of lays the strategy. So the PNA is very important to us as commissioners as well, because one, it identifies the need, but also welcomes competition within the market. On the island is specifically challenging, and hence obviously the wording around existing ones opening or the new one entering the market is what we really bang on in terms of when it comes to market entry, specifically where island is quite challenged in terms of traveling in and out, staff recruitment, etc. And those are some of the challenges pharmacy face where we are seeing less interest. Secondly, in the interim, our extended opening hour offer, as I said, we wouldn't do it normally or in normal circumstances if it was mainland or anywhere else, because we will quite rely on the PNA to reflect any gaps or processes for the contractors to increase their hours. But the reason we funded the extended opening, which we've also extended until February 26, is just that to give the stability in the island in terms of those extra longer opening hours that's needed, but also gives us a chance for the PNA to come out, understand what that contractor population is kind of doing, or inviting any new market entries on on the island to really give the stability and helping us to strategize. Second point around DSP, I note the point in terms of increase, but also that is what the national trend that we are seeing, and that is shift in terms of how patients are using. We also still, it's a challenge. There's no distance selling pharmacy that is located on the island itself. So it's still, there are 3 around Portsmouth and Southampton. So mainly used from there, transferred over, but it is around the timing of what that works with the patient. But how are we going to stop it? We cannot change patient behavior, but I'm really hoping that the strategy, the clinical services, or our outlook vision that I think James has described earlier would help us, that patients see pharmacy as that first clinical point within their community, able to offer a range of services that pharmacy needs rather than restrictiveness that it currently has. And that will kind of open up the avenue, one, for sustainable income, but also having that solid footing within the community, providing that clinical services, working in partnership within. And our ambition with all the advanced services or pharmacy income is, how do we ensure contractors on our patch make the most out of their global, some of the national contract, and how as local commissioner we can enable them with extra opportunities that is also kind of funded locally, but also meets our population need. So I think it's kind of 3-stranded goes in, and why this part of the document is important in terms of reliance. I just wanted to make a point earlier around the representation or the low consultation response. In terms of from the contractors itself rather than public, the LPC response, the local pharmaceutical response, obviously is done by the committee that is representative organization from the contractors. We do have 2 of the committee members from the Isle of Wight that sits on the LPC, and obviously the committee do rectify it and drafted the response jointly. So if that kind of gives the reassurance around low community pharmacy numbers, but overall feedback gathered by the committee and then an individual response kind of put in if that kind of supports. But we do take the point around less obviously response from community, and how we'll ensure how we can also support going forward in terms of ensuring when the consultation is out.
Thank you. Just if there's no further questions, just developing what Joe spoke about, which was I found is, I've made a few comments myself. I mean, it is the strategy to encourage people to have home delivery of medication, because that impacts the demand on pharmacies. That's the first thing. And to what extent, and I think it's related perhaps, is the strategy dealing with digital exclusion, and is that widely across this island? Digital exclusion being your own management of your medication, where previously you would pick up your medication and tick your paper, and it would come along and be delivered at the appropriate moment, at some usually 4 weeks hence. That now is left to the, let's call it the patient or the recipient of the medication. Is that a strategy that's quite widely adopted on the island and something that you are encouraging?
So I'll come on both of those, if that's okay. So the first one around deliveries, that is not the policy or something that we would want to be increased, because we want patients to kind of come out obviously seen. And that is where I think that the community contact comes in, the offer of services come in. We cannot provide any clinical services, look after well-being or mental health and well-being of a patient if they're indoors, because that touch point with that patient is really minimal. Also, delivery is not an NHS funded or any commission service funded. The contractors do it at their own back, and it's a free service that they take the cost of. So what we're increasingly seeing is it's should be protected because it's a goodwill that's provided by the pharmacy for the most in need that are not able to leave their house or hasn't got any means of transport, as described earlier in one of the comments, that is kind of used. But I still think that contact with the pharmacy, be it picking up their prescriptions, having a chat with the pharmacist, clarifying any obviously their health needs, etc. It is quite important. So it's not the strategy that everything should be delivered, because it goes back to the point of increased use of distance selling pharmacies, which you are obviously talking to automated systems rather than individual personnel as you do in a community pharmacy. Second, around digital inclusion and automated orders and stuff. So again, the national push around the NHS app has lots of advantages, but obviously it is bound to someone who can use the digital technology or has gotten access to it. But I think the message is quite clear, and so are we. We want the inclusion of new digital technologies because yes, it is it releases admin time at the pharmacy and at the GP and etc. But the paper format or what that patient needs, if they've not gotten access to anything, doesn't go away. Both GP practices and community pharmacies are quite accommodative. The only thing what we are doing in the automated order is to really reduce the waste, and hence that contact with the pharmacist. If they've not used certain medicines, don't need it this month, might need it in a month's time. Hence that is important, because what we are seeing is some sort of medicine pilage, medicine wastage that we want to stop, but also ensuring that patients are taking as they are taking. So our offer is not just digital, it's mixture of both, really tamed for that individual. And we do recognize the fact that technology won't be accessible to all, but at the same time, we need to really take on the opportunities as it provides us with as well. So I think that's...
Yeah, I agree all of that. And I think it just goes back to the earlier point that community pharmacies are more than dispensing of medicine. And the more clinical services we can provide in that setting, the better it is for the patient and the contractor. In the right circumstances, distance selling pharmacy has a role, but we're not seeking to rely on that. We're seeking to develop the infrastructure of community pharmacy on the high street and in the local community. And that's about providing more services beyond dispensing of medicine.
And just, could you just add a little more to why you believe that self-management of medication is preferable to an automated system?
So if the patient is stable, there is something called repeat dispensing that can be set out by a GP practice where it doesn't need changing, etc. And that, I think the example you mentioned around every 4 weeks is done by the patient, the prescription drops in automatically, and the patient is fine for 6 months, doesn't need any bloods or any monitoring. On the other hand, what obviously we are seeing is regular or as and when required medications that patients don't use regularly. When it's on an automated system, everything on that repeat is ticked for the patient while they're not been using. And 4 months, 5 months time, we get a lot of returns back. What we call one is over-prescribing that shouldn't have happened, but also over-ordering from either the patient or their representative or community pharmacy that is doing on behalf of patient. So really kind of reducing that medicine unused wastage is what I was referring to when I mentioned around that contact point. If it's done automatically, those checks and balances are not in place to ensure, one, that patient is taking the medicine, but do need it for the next month as well. For example, painkillers, constipation remedies, etc., might be on patient's repeat, but not needed month in and out. Patient might take it as and when required, and hence to reduce that medicine waste and really using and investing that money that in the medicine bill that we need, rather than stockpiling or unwanted medicine in patient's home.
And your assessment would be then that the over-medication is a result of patients over-ordering, which could be the outcome of people collecting their medication and putting their repeat prescription at the same time instead of 4 weeks later.
Yeah, exactly. And hence, I think the whole idea of order your prescription a week before you need is, as a patient, in an ideal world, what we would want is doing that check. Is that something they needed? Is it stopped? Am I using it? Or have I actually got it in the cupboard that would last me for the next month, and doing it? Well, again, from experience working in a community pharmacy, if you ask the patient while they're collecting, they're going to tick everything just in case I need it. I don't have to come back, and it's kind of done. And I'm not saying that is exponentially high, but also the clinical check-in point is important, and hence that visit into that community pharmacy that we mentioned, or we just know that they are taking it. Also, if they're not ordering every month, we know as well that actually it's a critical medicine. Why would one not order? And that two-way conversation is important.
Thank you, Karen.
I know this is probably a little bit off subject, but what are we doing to educate people on that then? Because I know that's not happening.
So we ran a campaign last time, and obviously we are doing it this time as well, something called Order Only What You Need. All the GP practices and community pharmacies participated in it. We are also going to do it again. So our message is changed to the patient. So say if it's a bank holiday, we'll be like, make sure you've got enough. You don't run out over the bank holiday weekend, but the rest of the year, we're doing kind of other messaging. Again, something I'll feed back to the comms and the wider team. But that is the campaign. We are running it again this year, and we'll see how we can kind of get out further. I heard parishes and local community centres, and maybe how we can engage with them in terms of getting that message out as well will be welcomed.
Thank you. Any further comments, questions on this? It does fall to us, as you can see in our papers, that the Isle of Wight Health and Wellbeing Board approves the final Isle of Wight 2025 PNA and agrees to its publication. We therefore have to do that or make recommendations or do something else. So I'm going to look to you all to either approve this or make some other recommendation, Karen.
I think we probably should approve it so that everybody else can do their stuff behind it to get it underway, because I think it's really, really important. And we can then get an update on the ambition of it going forward. Otherwise, we're not going to get the starting bit done.
And strategy. Yeah.
I think both of the points are well made, and James and Hanal have, offered to come back and talk through the strategy and develop the strategy with us. If we can't take this the next step today, as exactly as you said, we can't get moving, and our colleagues absolutely need this to be signed off formally in order to make any decisions about new provision coming into the marketplace. So if we're going to fill the gap that we've identified, we need something that's formally signed off to enable that decision making to happen.
Understood. Paul.
I agree with everything that's been said about, we need a strategy in place. Of course we do. I will only support it if another consultation is done, because I don't think this considers the age demographics of the island at all regarding digitalisation of the service. That's not been considered. The 6 responses, and it says in the paper, no, the 6 responses came from organisations. There was not a single public consultation response, not one of those 6. They're all from organisations. So I don't think this represents at all the views and the thoughts and the concerns of the Isle of Wight public. So unless another consultation is going to be done straight away, If it is, then I'll support it. If it isn't, then I'm not going to support it.
Anyone want to comment on that? I sense there's some disquiet here. I mean, we could defer, but I'm mindful of the risks, if there are risks on this. But we could defer on the basis, even if it wasn't a consultation, we had some idea what the strategy was, Karen.
Can I ask who can vote here? I'm a bit confused. Who can vote here?
We can all vote. Joe.
May I just pick up your point that you said you would only be prepared to support it if there was another consultation. The consultation that has happened has been part of this. So if it was supported, that would still, my understanding of the process would be that whatever is then published, which is what you've seen, would be what our colleagues would be able to make immediate decisions on. A consultation that came alongside this wouldn't be part of that formal P&A process. But in principle, there's nothing to stop us as a health and wellbeing board, taking forward some further engagement with our community that could inform then the strategy that the colleagues might bring forward. I'm just thinking, very about the formal process and what is required of the P&A versus what we actually need to understand.
If I may, if this was the 1 year plan, I would say let's approve it. Let's do a consultation properly for next year. This is a 3 year plan, and which is why I'm concerned about those 6 responses, none from the public, will last until 2028. And that's my only concern. It doesn't take into account the views of the public.
Ian, one second. Ian, please.
Yeah. The only thing that I think about redoing the consultation, if I'm understanding your point, Laura, is that it's still constrained by the technical terms of the P&A. And so we're just going to be sort of more or less back where we were. And so it feels like really letting this move on as a technical assessment primarily, but following on immediately with a service quality assessment, which feels as though it can't, under the rules, really be properly shoehorned into this consultation. Feels a very positive move, so that we actually talk about the quality of assessment, the degree to which that kind of community outreach partnership, the presence of pharmacists in the high street, all the things that we've heard about here can actually be properly deliberated. And then we're moving into the delivery of the strategy almost immediately to some extent.
Yeah, good point. Ian, Karen, and then we'll try and move.
For me, it's then making sure that these guys on the screen can then do their bit as well, and then come back to me, their ambitions, which they said they're going to do. And all of that part will be then the education of people, etc. It's really important.
Was it James wanted to speak?
Yeah, I think the point is if we extend, the recommendations will still remain because the gaps are still in place. I think moving forward gives us an opportunity to address the gaps, respond to the feedback, and engage our pharmacy community and wider public community, if you like, in terms of the strategy for community pharmacy moving forward. I feel that's a robust response to what is a sort of a technical document, and we're very clear on the requirements and the gaps. Let's now be clear on how we're going to address it and what it means. So we could extend. The risk with extension, Chair, is we end up in the same place with the same recommendation because the gaps still remain. As I think, as Joanna said, this allows us to get on, address the gap and be clear on plan, which I think is far more productive for the public and professionals moving forward.
Thanks, James. Sure.
Yeah, I think I recognize that the response rate was very, very low in terms of the general public, but we did get quite a qualitative response from the local pharmaceutical committee. And what that meant is our conclusions did change. They were modified. They were influenced by the consultation. So it's not as if, and therefore, the findings that you have are as a result of that consultation. So it was small, but it was qualitative. And I agree, it's not representative of the community. It is representative of the LPC and a few other members that responded to the consultation. We followed very, very strictly the guidance that was sent out by the Department of Health and Social Care in terms of how the consultation had to be conducted. We recognized the low response, so did a repeat. And the same thing, I think it's a reflection of the closure that you're seeing in pharmacies, the financial distress that you're seeing across the patch. We had that in Hampshire, Southampton as well. And I was thinking, do whatever you may. It's like flu vaccination among health and care social workers. You're getting that fatigue in the system. So I don't know whether by repeating a consultation will add to it, but the strategy on the other hand has that opportunity. So I take on board, it's been great learning because we can influence the strategy. How do we improve the penetrance of our messaging on pharmacy provision? Thank you.
Thank you. Look, I'm going to move to talk. We have some other things to discuss, and let's move this forward. There is some disquiet, it has been voiced, but equally there are risks of not moving forward. I think if we had some confirmation that the strategy could come back quickly with some updates, perhaps Paul, with some form of ongoing consultation after this, assuming that we're happy to approve this, I'd be happy to move this forward. But let's move it forward anyway, Paul.
Can we just add a third recommendation to Ian's point? Actually, the third recommendation that in 6 months' time we have another report on the quality of service presented to this board following a consultation with the public, something like that. Engagement with the public, yeah.
Thanks, Paul. We'll make a note of that recommendation, and that will become part of the 3 recommendations. So don't want to add anything to that. No. Therefore, Paul, will you second that now?
With the third recommendation in place, I will second that. Yeah,
thanks, Paul. So there we are. I just to add that Councillor Jordan, Brading, Lucioni, Colin Rowlands, Andy MacDonald, Ian Boyd, Joe Dare and Joe Jeffries can vote. Not everyone. I apologise for inferring that other people could vote. So therefore, those in favour of this board approving the final with the third recommendation that a report comes back in 6 months. Thank you. Thank you all. Sorry that was a bit of a labour at the end, but these things need to be aired, and if they're not going to be aired, we're not going to record our concerns. Let's move on to the Get Solent working plan. Who's delivering this?
Thank you, Chair. Just a reminder, I'm Steve Curtis. I work for Portsmouth City Council, but I'm here on behalf of the Solent Growth Partnership. And I've been working on the Get Solent working plan with Lee and the team from the island over the last few months. The Get Britain working white paper was published in last year, and it needs to be seen in the context of the rising benefit bill in the country, and also moves around curbing net migration. So that whole idea of getting more people in the country working, or at least economically active. And the challenge to local areas is to come up with their own local plan to support that ambition. And imaginatively, we've called ours Get Solent Working. And there will also be a Get Hampshire working plan developed by Hampshire County Council, but we're working alongside those, and where possible, we are aligning those plans with the view that if potentially in the future there may be a need to merge the 2 plans. But at the moment, they're 2 separate plans. And we had the challenge of delivering a plan, either an interim plan or full plan by July, and we've published a full plan, which we've shared today. But it is very much a point in time, and that plan will continue to be developed over at least the next 2 years. And the actions that sit behind it on the published plan are quite broad, and part of the reason for me being here today and attending other forums is to add some detail and some targets to those actions as we go through the next few years. The main target for the government, and indeed for us, is this employment rate of 80%. This is the a figure which is seen as is the target. This is a challenge not just for the UK but for a lot of Western economies. Why is it below that figure? The idea is that is the target. And Get Britain Working have identified a number of challenges of why we're not at that 80% currently. Just to make it clear, that 80% of people aged 16 to 66. And some of the areas that they've identified that may be of interest to this board is the fact that people excluded from the marketplace on the grounds of health, so that might be physical or mental health. There's also a prevalence of insecure and low quality work, and we know that has an impact on people's well-being if they're in work that either makes them feel unwell or makes them feel depressed, or they're not paid enough to leave a fulfilling life. Can have an impact. There's a number of other barriers that the plan needs to look at, including progression for women, skills shortages, and pathways for young people. Now, I've been challenged by the chair in a previous forum to come up with some numbers rather than percentages. So I will give you some numbers today, not just percentages. So, but it didn't make it into this paper. But as a sub-region, we sit at 75.9%. But what that means for the Isle of Wight in terms of people is there's 19,200 people who are classed as economically inactive. Now that is an average of last year. I've taken away how they're treating seasonal variations, but as for the last financial year, 19,200 people were inactive. Now, what an interesting statistic, this is ONS figures, an interesting statistic there is that of that 19,000, only 5,300 want a job. There's 14,000 people that do not want a job. You might ask yourself why that is. Well, in that 19,000, you've got over 4,000 students, you've got over 4,500 retired people. So as we've now published this plan and digging into the detail, the focus will be on targeting those people that want a job, and also those people that are able to work. And one of the big groups on the island is the long-term sick. We've got 5,600 people long-term sick. That went up by 800 last year. So if you look at the national trend, it is going up, and the island is following that trajectory. The good thing around long-term sick. The thing about long-term sick is, although Get Britain Working will not bring any new money as such, apart from to develop this plan, there is investment in the island called Connect to Work, which will target disabled people and people with mental health problems to get into work. So there is some money that will help with that long-term sick. Unfortunately, the amount of money we've got at the island is to get 843 people through of that 5,000. But they will be, with the greatest respect to those people, perhaps the people the hardest to reach, so people with a learning disability, people with enduring mental health. So there is some investment outside of this. There's also, I thought it'd be interesting, there's also 3,000 looking after family homes, and that's a thing we're looking at across the region, is how many of those people are perhaps carers of adults. Perhaps there's some work that could be done to help those people to become more active in the workplace. Interestingly, Hampshire are above 80%, and actually in Portsmouth, where I work, we're above 80%. But of course, as soon as you drill down into the detail, you've got some areas well into the 80s and some, very low, depending on your postcode. Portsmouth City Council are the accountable body, but the three local authorities are working together on this. And although there's some high overarching actions, there will be individual actions for the Isle of Wight, which I will come on to. We have had some funding to write this report, and some funding remains. So we've got 25,000 to give to the island. We've got some as an accountable body. So there's still money to do further analysis, further research, and run events should we feel the need. I think we've got centrally about half of the money left, about 50,000. In terms of the plan, the idea is that it's done in partnership. So with boards such as this, with the ICP and the ICB, and boards such as Solent Groves Partnership Business Board and individual business boards and economic development boards across the region. We have undertaken some stakeholder engagement. There's still more to do on that. But the two things that have come up consistently when we've spoken to stakeholders, whether they be businesses, the voluntary sector, everybody, is youth unemployment is a consistent theme. That's something the island, on the face of it, does particularly well in terms of young people in education and employment, but there is some evidence and from talking to people on the island that drops off after 19. So some good work done up until 19. There's perhaps, but afterwards it can drop off, and that might be masked in some of these figures. So that's something we need to look at. And the other thing is about staying well in work, and there's a project undergoing with the Integrated Care Partnership at the moment, looking at that we will link in with in terms of Get Solent Working. So that's keeping people healthy in work, either as anchor employers, because as a partnership we employ many thousands of people in the region, and we should set a good example. Also, how we can, as health services, help people stay in work. And there are a number of initiatives around Get Britain Working, like Workplan, which are encouraging people, helping people to stay in work. Just to say that the plan has been formally approved by the Solent Grove Partnership and the Integrated Care Board and the DWP. They've approved the plan, and the idea going forward that we will work as three local authorities with the DWP and the ICB to deliver some of these actions. We have to report back to the DWP, and there's a number of areas we have to report back on. And I've spoken about some of the young people, so we have to report back about young people. Also around disability, and one of the things on the island, we know that learning disabilities is something that's done particularly well on the island, and some lessons there to go across the rest of the Solent. There's some work to do around physical disability that we need to dig down on, and there's a piece of work to do around that long-term sick, of who those people are, why they're sick, so we can come back with some more concrete actions that this board may wish to consider. We also looked at Get Britain Working also talks about pay, and it's just to say one of the challenges from the last time we met was around whether the Isle of Wight are the lowest payers in the country, not as a council, I mean as a system. We're second worst in the region. Arda, which is down by Brighton Way, is slightly picks us to the post on the figures that I've looked at, but Isle of Wight is what is amongst the lowest in the country in terms of weekly wage for people. When I first looked at the data, one of the good things was that the gender gap between men and women in the island is quite small, but that's mainly because the base overall is so low. So it's not actually as good news as it may appear on the face of it. And I've spoken about the action plan. There's a number of particular island-specific actions around inclusive hiring, keeping talent on the island, attracting new businesses that can offer more secure work rather than seasonal work, and challenges around travel. In terms of health-related actions, there's the delivery of the Connect to Work programme, which Lee and his team will be working on, but also some further analysis, as I've said, of this 5,600 people. Why are they long-term sick, and what could we then do to help them return to the workplace, or indeed enter the workplace for the first time in some cases?
Thanks for that. This is for noting, it's not a decision. Thank you for the work on it. Thank you for coming back with the numbers. I just found it more helpful to understand the numbers that we were looking at on our island rather than 72%. And so just a quick question, is the 800 jobs that we're looking for to equalise us with Portsmouth and Southampton, is that for a maximum? Thanks. We've looked at this certainly at the economic board, and I don't know where else you're taking it, but I mean, these are interesting numbers and important for us, important for our community. Any comments on this? We're just going to note this anyway. No comments, we're all very happy. Ian, I know you're not.
No, it's become an obsession, sorry, but it's really interesting. Thank you. I think the issue of pay is absolutely foundational, is absolutely critical. So, and it depends which metric you look at. Of course, we're not looking to be worst, but it's really worth looking at, you know, the real-time monthly median data, unseasonally adjusted. And it's very, very alarming. And I think it's highly alarming. Obviously, you know this, I know, but it's just important to reiterate because the level of full-time employment is very low on the island. So the level of precarity through seasonal part-time work is very high. The level of unpaid care is extremely high, all of those things. But that feels as though it makes a very fragile economic base, particularly if you stick it alongside the demographics, which is an absolutely flatlining working age population. And that means that, and we know from our business life, small businesses shut, they're not replaced. So supply chains begin to fracture. So looking ahead, not trying to be too gloomy about it, but meanwhile, the opportunities that arise through the industrial strategy around things that the island is exceptional in, creative industries, one which has really come to the top. I mean, it's one of the 8 in the industrial strategy, and around life sciences, natural sciences, which is also one of the 8. We've got huge strength. So it'd be wonderful to see those come to the fore, which I think they are doing really, as an antidote to some of these deeply embedded systemic problems of precarity and low pay. So I'm really hopeful that your strategy is going to support that kind of drive.
Thank you. And I know you've done a magnificent piece of work that's been circulated on these issues that are facing our island. Thank you for that. Also, a lot of work involved in that.
Yeah, I welcome this report. Actually, when I first read it, I wrote down numbers, but you gave the numbers, and I've not been apologise, not been in previous meetings, but you know, it mentions numbers. The numbers you've given us really do bring home the Isle of Wight's issues around your 19,200 and that sort of thing. But there are some really good bits in this report that the Isle of Wight should be proud of. You know, personally, the one that stands out to me is the NEAT figure. You know, we're 4.1% of our 16 and 17-year-olds that say not in education or employment. Yeah, that's the lowest. Well, it's better than the UK average. So the Isle of Wight does do some, obviously less kids coming through the system now because our birth rate's low, but we get it right. 16, 17-year-olds, getting them into training or getting them into apprenticeships, or it's just that next step of making sure that they don't leave the island, so we need more houses for them, but there's jobs for them to go into that they can take those skills further forward. And I think, you know, there's some real positives in this report, and I welcome it. Thank you.
One of the challenges with these reports is you want to paint one picture because this paper may be used to get funding in the future. So we want to say things are bad, give us some money. But at the same time, we want to say there is hope, there is a strategy, there's a way forward. So it is a hard balancing act to get it in the paper.
Karen, then Lee.
So I looked at the 6 main streams that you're talking about, and we talk about over 50s. I know I'm over 50. I know it's a shock to people, but it's always been an issue. But actually, when you're talking about 18 to 66, is that an issue now? Because there are jobs there, so people are probably working longer even than that now. Is that an issue?
One of the things some of the problems we have in some of the health data is it's not always split by easy to split by age. It is out there, but it takes more work. So that is something we're going to look at. Some of those headline numbers, breaking those down by age. But you're right, people are working longer, and the concept of retirement is changing. And one of the challenges I have is a lot of the data sets only run to 64. The DWP are now looking to 66. The time this paper's finished, it may be 67, 68, even 69 that people officially retire. So there is that change. But yeah, there is a challenge for people over 50 in some of the data I've looked at, particularly around people with MSK problems. So perhaps people that people with MSK problems, so bad backs, bad hips, there seems to be a proportion of people there that we need to dig into. But that is something perhaps we will look at in more detail.
I wondered why it wasn't one of those 6, or, you know, a 7th one, actually.
So Lee, and then I'll come to Joe after Joe.
Yeah, just thanks for Steve for coming over and presenting that. I just want to let the board know that this is probably a good example of where a national programme has the backing of a very detailed plan, and there's some really good bits of work in there, and that the action plan that comes from that will be driven locally in collaboration, because there is some excellent pockets of work out there, and we're finding that when we're doing the background on the data and what work is currently going on, the island has some fantastic examples and some really good work, but I think what we're missing was we're not coordinating the work well enough to address some of these stats, and that's one of the key reasons for the Skills Board and the Economic Development Board, is to try and coordinate actions so we can make a difference into that data stream. And it's going to be a long-term goal, but that's what we're going to do.
Thanks, Lee. Joe.
Yeah, sorry, I've got to dash. I did just want to say, in response to Councillor Brading talking about our numbers on the island being good at 4.1%, we've been working really hard with the Isle of Wight Council and the DWP and the voluntary sector. So although I'm here to represent the whole voluntary sector, I'm just going to talk about what I know for a second, which is the fact that the Isle of Wight Youth Trust with the council and the DWP have got a youth hub, which is absolutely to address and support those 18 to 25 not in employment, education or training. And DWP figures are showing that nationally the conversion rate for that cohort of vulnerable people is about 6% if the DWP are just trying to work on it by themselves. We're running, by DWP's own figures, at 58% conversion rate right now. So there are things that we can do which are absolutely phenomenal, which undoubtedly impact on our numbers on the island. But that bit about working together and being really coordinated is absolutely vital. And let's go with a plan on the island and let's get going, because it's really badly needed, and link that into economic development as well. Thank you, and sorry I've got to go.
Thanks, Joe. Any further comments? Anything else you want to add? Ian?
Yeah, thank you. I think there's a golden thread here, because obviously I've got the poverty bit in a bit and been working with Lee around this, because this is critical in terms of trying to lift people out of poverty for the island as well, for that opportunity. Couple of bits, just in terms of the 80% employment rate, is that based on full-time equivalent hours, or is that based on any form of employment? Any employment.
And it's an annual average, isn't it?
And the plan time scale, I saw something to say 2028. I just wanted to confirm what the delivery time scale is.
Thanks for that.
Thank you. I just wanted to say what a great report it was. And obviously I'm going to say thank you for really weaving in the importance of those long-term conditions, and what is, there's always more data to be dug in terms of what is driving that at hyper-local level. My guess is that you're not going to find anything that's completely new to what we know, that the key risk factors that drive a lot of these long-term conditions, exacerbated, of course, by deprivation, are those behavioural risk factors around smoking, around not being at a healthy weight, around being physically inactive, potentially also some of the things that are driving MSK feed into that in terms of the types of work that people are doing. A bugbear of mine around the national focus areas is the way that the health of women is very much linked to caring responsibilities only. Yes, we know that women largely take up the burden of care in the population. Women generally live longer than men and live many more years in ill health than men. So that keeps women out of the workforce, particularly in later life. And that is something that isn't quite addressed in the headlines of the national plan, but I think it's important for us to understand that. And we do have a focus on women's health. It's in the NHS 10-year plan. We have a women's health programme of work that sits within the ICB. It has largely up until now focused on a kind of reproductive elements of women's health, the elements of women's health that only women have, but that is not the long-term aspiration. So I think you've got, all of these plans all around the patch have that kind of input, and we'd be really up for, that board would be up for kind of thinking about some of those things together.
Thank you. I think another board, there was a question about why should the island be different in terms of Southampton, Portsmouth, for example? Well, we've probably all got our views on that, but I thought it was a good question in general terms about why should it be so that we have that higher unemployment rate here?
It's a shame Simon's left. Our, as a health and wellbeing board, the part of the JSNA for the island that looks at the health of the working age population, it is a really rich resource of information that, I know it's been used to inform this report, but it can be used going forward as the work kind of comes into being.
It's a free resource on the Isle of Wight Council website. Fantastic resource. Look, thank you for that. Thank you for your time and effort and energy in bringing it forward. We've heard it, we've noted it, and appreciate all the work you're doing. All right, no doubt we'll see you again. Don't know where, don't know when. Let's move on to the Better Care Fund update 2024-25, pages 227. Is that you, Ian? No? Who? The Better Care update. Oh, yeah.
Apologies.
Yeah.
I'm not quite sure
Thanks,
if
Mark.
Laura's expected to join. She usually runs through this, but it is a report that we produce in collaboration. So I could take the board through that.
In the absence of, the recommendation is for us to approve the Q4 end of year report with no amendments. I can see Laura writing that. In the absence of anything and any meaningful further commentary, shall we approve that report? Those in favour, please show that are able to vote. Thank you. Thank you. We'll move on to the Isle of Wight poverty reduction strategy, a brief summary to aid government lobbying. That's interesting. Who's going to do that? Ian.
Thank you, Chair. Yeah, actually, it's a good golden thread with obviously what we've just heard in terms of Get Britain working and the Solent working plan. It does link nicely to what's going on, and it'll come across in some of the themes that have been highlighted. So just by way of summary for the paper, obviously, given the pace of some of the recent government announcements, particularly through the spending review and the position, it's identified a number of themes that we just need to be cited on and aware of. Part of the poverty reduction strategy for the island that was created end of last year identified that we may need to look at some lobbying with our local MPs to aid us in some of those considerations. So this report is focusing on 5 key themes. The first theme obviously is in relation to child poverty reduction, and there's some elements within that just to provide some impact, some context in terms of what the announcement may have suggested so far. One thing just to stress is that the spending review is very good at giving you headline statements. What it doesn't give you is necessarily the detail behind it. So until we're clear on that detail, it's very difficult to kind of gauge the true impact of it. That being said, it gives a flavour of what the potential impact could be, reading between the lines. The second one is to do with the Crisis Resilience Fund. You may be aware that we've had short-term funding through Household Support Fund. That's been announced that it's ending on the 31st of March next year. There is this new Crisis Resilience Fund, but as noted in the report, it's suggesting there's 842 million that's being provided to local authorities to aid that over a more medium-term settlement till 2029. That being said, as indicated in the report, there are a number of things that were mentioned in the spending review that seem to have been wrapped up within it. Discretionary housing payments, the holiday activity fund, and so on and so on. So again, until the detail is clear, it's very difficult to gauge precisely what impacts that may have. But what I would stress is that it is suggesting that it's a real terms cut in funding compared to what we have had. The third aspect is transport, and going back to Lee's paper just a moment ago, there is reference to that in page 87 of the plan, recognising some of the cross-Solent transport challenges, recognising some of the internal challenges of transport on the island as well, and equally from our health perspective, some of the challenges for those that have medical appointments and needs to the mainland. So transport is still a key element. Any lobbying would obviously be remiss not to include housing. And within there, obviously, one of the things we were hoping that may be announced is a review and inflationary increase to local housing allowance levels, but that was lacking again. And there's some examples of what the real impact of some of the housing challenges are for those that are on low incomes. And noting that as an island, we do have a low income economy and a low income benefits as well. It has a real impact to some of our housing challenges and links to the housing strategy that's been created for the island as well. And then finally, the public service reform. It's really important to mention that because the spending review made some considerable announcements around expectations for core spending power and funding, with, shall we say, an over-reliance and expectation on council tax increases in the future. As indicated in the paper, for the island, we do have a very high council tax base in terms of the value compared to some other local authorities, and there could be some disparity with the expectations how that funding will be achieved. One element that was missing in the recent announcements was in relation to the two-child benefit cap, as indicated later on in the report. Now, government have obviously, shall we say, backtracked in terms of the personal independence payments in review, but one they haven't as such yet is the two-child benefit cap. And paragraphs 17 to 19 give you an indication of what that means. On top of the local housing allowance limitations, as you can see, it can have a considerable impact to households on the island who are impacted by that. So the report basically is just to give this board a flavour of some of those challenges, recognising the links to our island's poverty reduction strategy. And it's seeking buy-in and support from this board, please, to lobby our two local MPs in terms of presenting some of these impacts, to continue that discussion at the highest levels within government, to recognise some of those challenges and specific needs that the island particularly has, not least nationally as well. So yeah, that's a summary of it, Chair, and happy to take any questions. Just to say as well, if I may, just a reminder for this board, this is not an Isle of Wight Council strategy. This is the island strategy that's been co-produced with partners and organisations across the island. And a number of colleagues have been participating in this meeting today and are still here. And it's our collective efforts to try and look at some of those challenges.
Thank you, Ian. Thank you for that clarification. Of course, we have seen it at this board before, the actual strategy. This seems to be, correct me if I'm wrong, Ian, a recommendation for us to encourage our two MPs to get the train up to Westminster and knock on the Prime Minister's door. That will be interesting to see. But
and there's a draft letter there as well to help with that in terms of context.
Drafted the letter.
The draft letter's there for any amends. It's just a suggestion.
Any comments on this? We have, as I say, the actual strategy. It's been through here, and it's a good clarification. It's not the Isle of Wight Council strategy. It's an island-wide strategy. Complex and complicated that it is, but today we're being asked to agree to approach the local Isle of Wight members of Parliament. That's Joe and Richard. I'll come to you, Karen, to seek their support in lobbying government for recognition of impacts and detriments of poverty to our island residents, thereby supporting the needs of local people. Karen.
I'll absolutely support this.
Ian.
Yeah, absolutely. I think it's essential. And I think maybe the Independent Commissioner on Neighbourhoods interim work sort of supports us as well, because it divides that information up into constituencies, and obviously picked out Isle of Wight East as being in very dire need, second only to Blackpool South. But in the full report, of course, it will pick up Isle of Wight West, and that won't be very far behind, I don't think. So there's already a constituency level sort of evaluation of need through a body that's advising direct to government. So I think backing it up with this, and just to put my IWELC hat on for a moment, I think there are, because obviously the constituencies are made up, I think it splits 1914 the way the parishes divide up, but certainly within those constituencies there will be parishes very, very keen to support that lobbying effort. And I speak from Sandown, where we've just been doing a huge amount of consultation on exactly this message. So there will be hyperlocal data and support available at the parish level, I think, as well, should that be helpful. So, thank you.
So it's a good point that we need to capture that. Actually, it's a very good point. I'll take that with IWELC. Paul.
Yeah, on a similar point, where I think a lot of the information in here, yes, pie in the sky figures from government, and when you drill it down to local levels, but I'm not sure all 39 of our county councillors really get this. And I think there's a real, I know this board, and you see this vote, I think all the councillors in this chamber should see this information, just to really drum home the point to them. We had a conversation at our committee meeting last week around the SCND system. It's absolutely knackered. Our high needs block spending, we are £12 million overspent, predicted to be £25 million by 2030. Hampshire are 300 million overspent, and the government have got a real problem to sort this out. They've got not a clue. All governments, not just the current Labour government. Yeah, this problem needs sorted. But just to put it in context, if the safety valve, if the government removed the safety valve, we haven't got £12 billion in our reserves at the moment to pay it. That it could bankrupt 40 councils could go bankrupt just like that by the government removing a safety valve. So they've got a real problem. Do the MPs really get it, understand it all? I don't know, but they are councillors as well of this council still. So I think sharing this information, how we do it through a leaders report or whatever, with all the councillors, just to give them a view of the numbers involved, I think it's quite important. Education part of the parishes as well, as Ian quite rightly said. It's a really good report, Ian. Thank you.
Thanks, Paul. Absolutely need to support Joe and Richard in their work, and with the help and support of our town and parish council as well. Absolutely a combined effort to government. We had I don't know if you referred to this, Ian, the initial fair funding review that has been briefed to me by our Section 151 officer, Chief Financial Officer, shows a 2% reduction of funding to this council over the 3-year period of the review. Just some further good news about funding. We continue as an authority to try to encourage government to recognise the the specific problems the island faces. We've heard them on employment and on poverty, on health and wellbeing, across a whole range of issues that we are facing. And thus far, we've managed to secure £4 million each, £4 million each year, against an ask of something like 24 to 27 million per year. So our estimates were around financially 24 to 27 million a year was the disparity for this island compared to comparative local authorities on the mainland, and government recognised it. We got very excited and then gave us 4 million of the 24. So there's still work to be done there. And what government seems to do is putting a lot of effort and energy into both devolution, certainly for the Solent area, and local government reorganisation across the country. But nonetheless, we will work with our MPs. We meet regularly. We meet every month. I can contact them fairly easy because they are councillors in this council, and we need to get behind them to try and move government on this. But I do think it's going to be an uphill struggle to get government to change some of their broader policies on this. But we must continue to press for better funding for this island. The fact remains that our funding disparity, we believe, at least as an authority, is evidenced, and we are shortchanged by government as an island. So leading to some of the issues that we deal with. And then I guess finally, if I just might add, sometimes I've been to these meetings over quite a few years. And sometimes it's hard to see sometimes what the reference is to some of the issues we talk about, but they are multifaceted and they're multidimensional, and they require lots of actions by lots of different organisations to try and address some of the issues. Poverty is a wide issue. It's not a simple, but create jobs. How do you create jobs? It's quite a difficult problem itself, but just say you could flick a switch and create jobs doesn't lift people out of poverty necessarily. Increase the health of people certainly increases, certainly affects how poverty is seen, but it's not a flick switch. It's all of these things that we need to address. And this board should do that, at least strategically, with people going back to their organisations and trying to deliver some of the strategies that will impact and improve the health and well-being of our island. So I didn't mean to stand on a platform and say that, but often I sit here and see, I'm sat looking at people and people say, I wonder why I'm sat here. You know, we're talking about things that are pretty way off what I do. But actually, we're all involved, all of us and our organisations, in improving this island and our community. So thank you for bearing with me for that. The recommendation, as I say, is to encourage, to approach the local Isle of Wight members of Parliament to seek their support in lobbying government. Are we happy to support that? Please show those that can vote that do. Thank you. We've made a note of that. And finally, let's move on to our work plan, just to page 267. If there are any comments, changes required, additions, omissions, or things that we need to slip or drop. Any comments on any of that? Karen.
The ICB coming back and telling us about the work plan and their aspirations from the
that needs to be on the work plan.
From pharmaceutical paper.
We made note of that, and that will be entered up. Thank you, Karen. Good point. Any other comments? No other comments. Well, look, thank you for staying the course. It's 11:10. I feared we may have been later. Our next meeting is October, and look forward to seeing you all there for those that can make it. Sorry?
this is our last health and wellbeing board as a public health partnership. So when it comes to November, you'll have a new DPH who will take their place on the board.
Thank you. Okay, so Journey, take the rest of the day off. You put in